Hi, everybody. My name is Katie Jimenez, and I'm the Outreach Manager here with Iris Telehealth. I do want to just say thank you guys all for joining us today. We're very excited to get the opportunity to talk to everybody about what it's like to come join our team. So with me today, I have Dana Foltz and Dr. Tracy Millar. We are all Iris employees. And I'm going to give you guys a chance to introduce yourselves. So Dana, would you like to go ahead and start with that?
Absolutely. Thank you, Katie. My name is Dana Foltz, and I'm the Director of Clinical Talent here at Iris, and excited to speak with you all today, although it be it virtually, and thank you so much for coming.
Thank you, Dana.
Hi, everyone. I am Dr. Tracy Millar. I am a child and adult psychiatrist. I am the Medical Director of Ambulatory Services here at Iris, and I've been with Iris for a few years. I started in a clinical role and then transitioned to administrative role. So I've had a wonderful experience getting to know the company from both of those perspectives, and I'm super happy to share my thoughts or answer any questions today.
Absolutely. And once again, I'm Katie. I'm the outreach manager. So my job here is to make sure that I go to events and do a really good job in our communities and making sure that people know who we are. Some of you guys may have spoken with me. I also handle any residents or fellows or people that have yet to complete their training programs. And just, something about Iris that I value a lot is that we really do place people above all else. And so instead of getting like an automated email saying, oh, wait till you're done, finish with your program, you actually get scheduled with me. And that way I get to talk about our career opportunities and who we are. And I just could not be more tickled to be here. So we're going to go ahead, and the way that this will work is we're going to have a chat box. There's not a way for you to unmute yourself to ask any questions or anything like that. So please just put your questions directly into the chat box, and Dana will be reading the questions as we go. There will be a Q&A section where we'll be answering all your questions. So if you do think of anything during the presentation and really understanding the history of Iris and how our process works, please feel free to just drop that directly into the chat box, and then we'll read off your questions. If you would like any specific follow-up information that maybe we don't know about at this point, that you're really interested in joining our team, please also include any information of that nature. And then we'll be following up after this with the recorded video to all attendees. So with no further ado, we're going to go ahead and talk about the history of Iris and how we were formed and why we exist. And Dana Foltz is going to go ahead and kick us off.
Great. Thank you, Katie. So I always love this picture. And of course, Iris is no longer housed in this little yellow house that you see there, but it really, and when I think about the beginning of Iris, this is what I think about, and that we have been a company since 2013. So I often tell people we're kind of one of the older kids on the block when it comes to thinking about telehealth. And we've grown a lot, obviously, through the pandemic, but we were alive and well and started, much before that time. And good medicine is the heart of everything we do. I think that you will find that in speaking with any of us at Iris, certainly our medical leadership, Dr. Tracy Millar that is here, and that we are owned and operated by a child psychiatrist, Dr. Tariq Shaheen, and he is who founded and started Iris. And so we really, when we look at partnerships with organizations that we are going to have one of our providers do telehealth, we are very clinically minded in that patient care is the utmost concern in having quality of care. So couldn't, I wish I could actually have Dr. Shaheen, or I know Tracy will speak to this a little more, but that is really what brought me to Iris, is that is the biggest thing that we focus on, and that is just patient care. At the end of the day, if the patient's winning, then our providers are winning, and our partners that we are looking to expand care for. So without further ado, I will kick it back to Katie so she can look over the company profile.
All right, so this is really who we are. And like to Dana's point, we were founded by a child psychiatrist, and we're not new kids on the block. We weren't formed or born out of COVID pandemic era public health emergency rules. We really have focused on making sure that we're providing really good quality care to our patients and that we're a very provider-centric organization. So our company profile, we actually currently have 277 medical providers. That is a mix of psychiatrists, PMHMPs, and LCSWs. However, the bulk of that number, 277, are psychiatrists. We've recently just expanded a lot of our service line to also include those LCSWs for therapy needs as well. Like you've heard already, we were founded in 2013 by Dr. Tariq Shaheen. He is a child psychiatrist, and he continues to be the physician-led medical group liaison. We have 237 service lines. That includes partnerships in 30 states, and our average partnership length is 4.25 years. And our NPS score is 84. So those of you that know about an NPS score, that's a net promoter score. That's a very, very high number. That means that a lot of people are going out there and saying really great things about who we are and what we're doing. But one of my favorite things to tell anybody who's thinking about joining IRIS, because this number is pretty unheard of in the industry, we actually have a 96% clinician satisfaction rate and an 88% employee engagement rate. Industry standard is actually around the 70 mark. So this is something like when I'm talking to potential, new hires and candidates, this is something that I love to talk about because, we frequently ask for feedback to make sure that we're really doing the best job that we can. And 96% satisfaction rate and retention rate is huge. So we are 100% behavioral health. We have gotten really good at what we do, and we're not looking to expand into other markets. We really, really want to stick with, behavioral health. Like I said, that 96% clinician satisfaction, and we also have 97% patient satisfaction scores. I really believe that the reason for such a high patient satisfaction, because once again, that's far over industry standard, is because our clinicians are satisfied. If we, our mentality is that if we take really good care of our providers, they will in turn free up time to do what they love, which is to treat patients. And that's kind of, there's been a lot of studies done that clinician and employee satisfaction is a direct impact on the patient experience. And I do want to just read out, this is actually one of our current providers, Dr. Romero. She said that working with IRIS has been a pleasure, and every interaction I've had with the IRIS team has been positive, kind, and helpful. We'll go into our values a little bit later, but that is definitely, I believe, a true testament to who we are as a company. So why IRIS? Like, why choose us over, additional, other competitors in the market? So we have really good additional perks. We have 24-hour around the clock IT support. We'll also do all your home office setup. That includes all the hardware and software that you'll need to truly, be able to do your job well. I know that I've had to sit on the phone with IT before because something's not been working in previous lives, and it's like painful at best to get through to somebody. So here at IRIS, we actually do all our own in-house IT, and they are a phenomenal team. So some of those technology hiccups that sometimes become a barrier to patient care, we figured out how to remove that. Less paperwork. I mean, who doesn't love less paperwork? Very few people that I interview are saying, yeah, I would like to do more admin work. I would like to do more paperwork. I want to spend less time with my patients. That is not who we are. We want to remove all the barriers and red tape out of your day to make it where you're really, truly able to provide the best care to the patients. I call that like pebbles in the shoes. So like every day that you're walking and you've got a tiny little pebble, it might not bother you so much in the morning when you start your day, But when you're, hour 6 of your day, that pebble is rubbing a hole in your foot. So we really, really focus on making sure that all those barriers to care are removed. Being psychiatrist led, right? you know, and not to knock anybody that's in the industry now that just is entering, as far as competitors, but we're not a tech group. We were not formed because of COVID, and loosening of those public health restrictions. We truly were founded with patients at the end of the day, in mind. And so having medical leadership involved in our business, decisions has been critical to our clinician and provider satisfaction rates. I always like to tell people, like, when we decide to partner with a clinic or an opportunity, that our medical leadership team is really vetting who we're bringing on as a partner. And they're looking at things like, visit times, patient panels. Is this going to be an opportunity that our providers are going to be excited about? Or is there too much bureaucracy or red tape, and then we don't do business with those folks? And that's really a big benefit of being psychiatrist led. And then work-life balance, right? Like, telehealth has really allowed people to have more time for the things that they love to do. Whatever that looks like in your life. Commuting for me pre-pandemic, was 2 hours a day in a car in Houston in the heat. And those of you that are not from Houston, it's a tough place to live as far as traffic and, just commuting in general. Everything's like 45 minutes away. So just getting that work-life balance back is really, really a big reason why, we have been so successful. And then great benefits. So we have health benefits. We consider full-time at 30 hours. So at 40 hours, so I'm just going to quote a 40-hour kind of benefit package. That is 4 weeks of PTO at 40 hours. It's accrued, so if you're at that 30, it's a little bit less. But that's also 6 company holidays, 75% of your insurance premiums paid by us, as well as life insurance, 401k. We also have like CME stipends of $1,500 a year, as well as an office stipend account. So even though we're setting you up with all the technology that you need to do your job, you'll also have an office account, and that can go to pay for things like, like internet access or an ergonomic desk, whatever that looks like to make your office really comfy and appropriate for you is really what that office stipend's for. We also will cover all of your licensing fees, credentialing fees in whatever state that you're operating in, and obviously malpractice. And we do a occurrence-based policy for our malpractice.
I will add
So
too, I
yes.
saw in there that you had, less paperwork, and the licensing and credentialing piece obviously is a huge part of that. Knowing you're working remotely, that our focus is on really finding you the best clinical environment, that means that you likely would be working out of state. And so our licensing and credentialing team is exceptional here. And the best way I can always, communicate that to others is upon implementation, our clinicians receive a survey to say, how did we do up until this point? And our licensing credentialing team always gets the highest marks, 10 out of 10. And nobody likes licensing and credentialing or the process. So I think it's always very impressive and speaks to the department as to what they really do on the IRIS end to handle the paperwork and a lot of the red tape that happens there.
Absolutely, Dana. And yeah, we have the best credentialing team that I've worked with to date. And to Dana's point, nobody gives high marks to the credentialing process, except here at IRIS, right? So we do a really good job with that process. And so let me kind of talk to you about, like, what type of careers. I get asked that a lot, and the answer is all the careers we have. We really do have a really good cut of the market where we are really, really able to operate in a lot of different modalities and with a lot of different types of care models. So we have adult and pediatric careers in acute care. This would be like where you're paired with a care team as part of a dedicated pod that works across a group of partner systems. We'll help you get to know the medical staff you'll be working with, including doctors, nurses, leadership, and technicians. And you'll also work with closely with our own telehealth care team coordinators who fields consult requests, and our acute care operations team who ensures you have everything you need. So I used to do physician practice management, and one of the biggest hurdles for us was we used to have to transfer to the ED a lot, and you would call the ED and you would wait on hold and you would get transferred around, and hopefully you could get to the charge nurse or the doctor on call. Here we have all that taken care of for you through our wonderful care coordinators. I mean, they work around the clock to make sure that you're not sitting around waiting for a phone call back, or that you're having problems connecting at the ED in our acute care settings. All right, ambulatory care. So, and this is a bulk of what we do. So this is where you're working very closely in ambulatory. You work with a clinical operations manager. We call them COMs here at Iris. We love acronyms, so we call them COMs. And what they are, the best way to kind of describe it is like almost like a white glove concierge practice manager. They're your rock removers. They're your people that are going to make your job easier and help support you. So if there is an issue at one of our clinical partners and you need to, you know, escalate an issue or anything like that, that's where the comm team really comes into play. They're also really responsible for your onboarding as well as your go live and getting you ready to really integrate into a brick and mortar facility where you'll be seeing patients. So together, this team identifies opportunities that match your goals, your criteria. They manage initial admin tasks and connect you with the team at your assigned clinic. And as a IRIS provider, your COM will support you and make sure you have all the resources you need to provide the best care possible. Like I said, it's that on-demand practice manager that's specifically assigned to you in order to make your life here much easier and kind of get rid of some of those headaches. All right, so adult and pediatric careers. So we've got new and innovative care models. So as part of this provider team, you'll be involved in our referral management program. You'll be helping patients transition from crisis to stabilization, bridging ED, acute inpatient, and inpatient psychiatric care to manage outpatient community care and into the home. This program works to effectively prevent unnecessary readmissions by ensuring patients get access to the care they need when and where they need it. All right, so we're going to talk about our core values. So you kind of learned about our history and what we do. So this is the why and the how. We are, you know, there's a lot of buzzwords going on right now about company culture and burnout. And we really do live our values here at IRIS. We're very almost fiercely protective of who we are as a company. And our core values are just that. They truly are in our core. And that's people over all else. We say that's like the foundation of the house. Okay. Suck less every day. Execution is king and queen, or queen and king. Be quick, but don't hurry. Love your work, live your work. So to talk about people over all else. So we value our relationships with employees and organizations over all else. Acting with integrity and respect, we do the right thing. Our people, both internally and externally, are our competitive advantage, and we prosper or fail based on the strength of our teams. And this is something, like I said, this is our foundation. This is our whole reason we're here, is to make sure that we're connecting into our communities and providing good quality healthcare, mental health care to folks. So this is really like the foundation of our house. Everything else is kind of secondary to this. Suck less every day. So we call this sledding. You know, when I first started, I was like, oh, that's different. But yeah, we're a different kind of company. We really are here to really suck less every day. And it gives us an opportunity to really refocus on like what works and what doesn't. So this is journey towards excellence. To suck less implies that each one of us has greatness within us if we dedicate ourselves to continual improvement. And Dana, did you have something you wanted to add on suck less every day?
No, it's just that when we speak of these values, I think just overall, it's not just speaking of them and that it's something that from time to time we bring up. It is truly a part of our culture here. When we are, in meetings and we have a pain point, suck less every day is thrown out there as this is something we're going to improve upon, and it has to, in part due to our values. And so they really do stick with us. We have, our culture is to look at fellow employees that are exhibiting these values as well. So I just want to add on there that it is not just something that we discuss here and, don't bring up again. It really is a part of our everyday culture here at Iris.
Right. And even to take that one step further, like these are actions to us, right? So they're values, but they have actions behind them. So, sucking less every day is reevaluating our processes, making sure that we're doing things the best way that we can, that we're removing pain points. It's not like a value that you write on a wall and then don't know. We really try to act within our values and not just let them be talking points. Like we really live these values. That's a really good point, Dana. All right, execution is queen and king. So ideas alone produce nothing. It is only through putting in hard work that we accomplish real results. We believe dependability is key to trust in relationships, and we do what we say we will do. It's just that simple. I'm sure some of you guys on this call have had people that are fixing to do people in your life. I'm about to do this. I have this great idea. And then those things don't get done. So we have process improvement teams that when we say, hey, we're having a sled moment, we need to fix this, that's when execution comes in. And if we say we're going to do something, we follow up on it. If we say we're going to have an opportunity for you by this X amount of time, that's what we're going to do. We walk the walk and we make sure that we do the things that we say we're going to do, and we hold up our commitment. That's very important to us. And like Dana said, like I'm saying, these are action items. All right, be quick, but don't hurry. This is one that I tell myself constantly because I'm a very fast mover. I like to get results quickly, but we only want to move as fast as possible, but no faster. We do want results quickly, but never so quick that quality of care is sacrificed. So that's really, something that I think is very important, that we look at the quality. And what is quality? It's the quality of our patient care that we're doing. It's the quality of our providers that we're bringing in. It's the quality of our own work teams and our own internal processes on the corporate end of things. So striking this balance is no easy task, but it is one of the things our partners and providers love most about working with us. And once again, we do what we say we're going to do because execution is queen and king. And that's why we hold up our end of the bargain. I think that's really important these days, is to, be honest in our dealings and move with urgency, but don't cut corners. So love your work, live your work. This is actually on my notepad that Iris sent to me when I first started. And I say this all the time. To love your work is to be passionate, doing our best on every task. There is a small reflection of ourselves in each action we take. And because of this, we put our hearts and souls into our work so we can be proud of our results. This one is kind of, to me, just very, very important. And I can say I love my work. I live my work. I speak about my work when I'm not at work. This doesn't mean don't have work-life balance. It means truly do what you're passionate about. And for me, helping underserved communities, helping people bridge the gap in finding psychiatric care and mental health care is absolutely beyond critical to me. Personally, And it is absolutely one of the foundations of our company. You know, we do work with some of the most passionate people that just really care about, um, you know, really embodying and encapsulating all these principles, that some other companies that I've worked for just uses like talking points. You know, this is really something that all of us on this call are extremely passionate about, the people that we're ending up helping at the end of the day. And so we put our hearts and souls and blood and sweat and tears into everything that we do. All right. So I am going to turn it over to Dr. Muller. And let's see, do we have any questions by chance, Dana?
We do, yes, Katie. We do. So I can read off the questions, Dr. Millar, and then we can all kind of chime in too, because I know some of them you may want us to speak to. But one of the first questions, and I think this is always a great one, is what goes into the placement process of a provider, or the matching process? What is taken into consideration as to where a provider is working?
Yeah, so that is a great question. And I think when I started as a provider with Iris, and I started working in a residential adolescent treatment center was my clinical position. I worked with Dana, and my original COM I still work with, but on the administrative side. And I can say, although folks were so helpful and answered my questions, I had a minimum appreciation for how much work goes in ahead of time to vet a clinical placement before there's a partnership, before we even consider having it as a clinical opportunity. So I can speak maybe to that piece and how we screen and consider partnership, and then maybe pass it off to you, Dana, about how some of the interview process.
Sure.
But I can say we take a lot of time scoping out and researching clinical opportunities. And we look for those partners that are looking for permanent, long-term, passion-driven providers. So if we're not partnering with those clinics that rather have a locums company, just a temporary fill, that's not what we're about. We're looking for placements that are long-term potential, where our providers are fully integrated into their teams, as if it's someone, you know, on the ground. They're fully expected to have great communication with the clinic, are fully involved. They're not siloed in delivering virtual care. So there are a lot of quality measures and a lot of conversations. We don't partner with a clinical setting where we all wouldn't want to work. We're Joint Commission accredited. That was one thing that really impressed me when I was interviewing for Iris. And that emphasis on quality standards definitely pervades the company, for sure. So I have been really impressed about the commitment to really analyze these potential opportunities before a provider is placed. And, you know, I myself, Dr. Tom Milam, we do a lot of candidate interviews. We ask a lot of detailed questions to understand provider passion, what their preferred patient population, setting, et cetera, because we want to find a setting where they're happy and where they want to stay, because then they have great provider satisfaction and patient satisfaction. And Dana, you can probably speak. I mean, there's so much that goes into the process of finding a placement after we've gotten to know providers a little bit and understand what their preferences are.
Yeah, no, absolutely. I mean, I think the biggest thing is that we know first and foremost that when you are looking for a new job, and specifically with telehealth, flexibility is a huge reason as to why you're doing that. And so, you know, there's obviously a list of reasons, you know, and preferences that individuals have, but we, throughout our interview process, really want to individualize and personalize what your preferences are. We don't, there's no right or wrong answers to any of it. And I often find that as I'm having these conversations with candidates, that they find it refreshing, because we truly are wanting to place and match you with your preferences, so that is the schedule, hours that you're going to start your day and in your day, total hours. Our minimum is 16 hours because I saw there was a question that came in as to, are there part-time opportunities? Yes, there absolutely are, but our minimum is 16 hours per week. Now, the other side of that is it doesn't have to be 2 8-hour days. It could potentially be 4 4-hour days. So the schedule is a big, part of what we talk about. But then obviously, I think there are the knowns. Our candidates know which setting they prefer, whether it is outpatient or more of acute care model. And we really want to place you in that setting. And then obviously the patient population that you're going to work with, ages and diagnosis wise. So there's a lot of conversation around those details and about volume of patients, the amount of time you want for that initial visit, for med management, follow-ups, documentation, time in the day for that. All of our sites are unique in that there's not a cookie cutter that I could tell you as far as volume of patients or ages and diagnosis. It is unique to that site. Now, Iris obviously has benchmarks, and that's what Tracy was speaking to. There is a lot of thought that goes into who we partner with, but we want you guys to know as we're talking to you that we are really identifying what your preferences are, so we take those into consideration when we do a match. So
Absolutely.
anything else to add on that was missed?
I was just going to say, when I interview people, my question is, tell me, like, the sky's the limit. Tell me what you're really looking for. I also ask, like, okay, what are on this list? What are things that you're flexible on? Because flexibility does obviously open some placement options for you, right? If we understand what your drivers are, your key drivers, things that you're passionate about, that's what we go look for. As far as, like Dana was saying, like hours, how many patients that you want to see, all that good stuff. And then I'm like, okay, so what don't you want? What would look like a not fun day for you? And then we avoid those. And it's really great that during the meet and greet, so after you've kind of had a placement identified, everything about that partner is known to you at that point, meaning your hours that you're going to work, your pay, your, patient panels, all the nitty gritty, who your care team is, what wraparound services you have. And we actually attend that meet and greet with you as your, like, Iris representative. So that way there's a really good cadence of communication between you and your clinical opportunity.
Yeah, and Katie, and Dr. Millar, there's a question that came in. I think it just kind of carries on this conversation that we're having now. Is, does Iris have an average time people spend on consults versus follow-up?
And so is the question, I want to make sure I understand that the question, because there are two roles I think that we're talking about. There's more of the consultation liaison kind of traditional role that is sort of one arm. And then there's the more ambulatory care with intakes and follow-ups. I'm not sure if that is what this question is about. Because that's something we definitely ask about preferences if somebody wants to be doing that more consult liaison role versus an outpatient opportunity assessment and follow-up model.
Yes, yeah, I believe so. And then I think maybe then the other question would just be, do we have an amount of time allotted for an initial visit that Iris carries across to all of our partnerships versus follow-up or med management visit?
Yeah, no, great question. And again, each opportunity can be unique, but our benchmarks are what we recommend to the clinics are an hour intake and 30-minute follow-ups. I can tell you that, we really scope our clinical settings if we never do 15-minute med checks. If someone was recommending a 20-minute follow-up, they need to have a certain percentage of no-shows to accommodate. But by far and large, the traditional ambulatory care setting, it's 60 minutes intake, 30-minute follow-up. Again, some variability. If they're a complex child, that can be an outlier. With more time, it's a really an individualized schedule, and that all becomes apparent to folks when they're thinking about and learning about an opportunity.
Very good. And somebody did just say that they have to go see a patient. Is this being taped? Yes, absolutely. You'll receive the recording in the coming days if you did have to hop off.
And this is a great question, is who takes care of the billing, the clinician, Iris, or the partnership company? And I can answer that one. It is the partnership company that handles the billing with the patients. And then seeing another question come in here, and does paperwork help refer to assistance completing prior authorizations or FMLA?
Yeah, great question. And so each clinical setting will have their own sort of telepsych champion, we call it. So if it's a medical assistant, a nurse, someone on the front end that helps our providers with the schedule, checking in patients, admin tasks, and that is definitely another piece of information. We make sure that you know who's on the care team, and that what scope of work your admin role is. That's something we ask about because we need provider time for administrative concerns. And we really are making sure that our providers aren't getting bogged down by them. And again, we're trying to remove any headaches during the day so that our providers can focus on clinical care. I think that's a theme we come back to frequently. We just want to take all those headaches out of the day so our providers can focus on what they're passionate about.
Great. This is a great question that I know we get commonly. And so what happens if you have a no-show? And of course, also addressing as far as how does that impact compensation? And Iris is not a fee for service. If you have a no-show, it's scheduled time, you will be paid for that time.
Yeah, and that's one of the things that I love talking to candidates about is that we're not, in our outpatient settings, we're not running RVU-based compensation models. The reason why is we want to make sure we're not cutting corners. We really want to move more to that value-based care model and making sure that, you know, the visit times are not cut short due to money incentives and things like that. We really want to make sure that you guys have stable salaries that you can, really plan your life around. So just knowing that we don't do that production-based pay model in that outpatient world.
Absolutely. This is a great, what does Iris look for in a potential candidate and value as key skills aside from credentials and experience?
Yeah, I can take that one. I mean, I feel like, by the time a candidate reaches me, I know they've had conversations with clinical hiring, and it's just such a pleasure, a part of my job that I get to talk to these folks that are, obviously everyone has gone through so much effort in their training, and, they have generally experience and a passion for the work that they do. So we're really looking for those candidates that share the passion that we do for patient care. And that's, why we ask so many questions at the beginning about what our providers are passionate for, because there's not one answer in terms of patient population or age or setting. So that we just want to know, what our providers are most passionate about, because we find when we find that long-term, that clinical fit that feels so good to a provider and patient, it's such a great connection between our provider and the clinic, and the patient just so benefit from having that longitudinal care where our providers are just happy and want to stay where they want. So we just love hearing from providers like what they're passionate about.
Absolutely.
So I've got some LCSW questions coming through. So yes, we are absolutely hiring LCSWs. That is very, very, very much so true. So the journey for that actually, this is also very cool. I got to go to the NASW with DC this week or last week with our LCSW team, and our LCSW recruiters are LCSWs. So they really can speak to very specific therapy, models and different types of therapies, and really make sure that you're in the right place. So if you're an LCSW looking for work, we definitely are hiring. That is very much so a huge need in our business. This is actually something that we've really grown into. So if you have specific LCSW questions outside of that, other than like what the candidate journey looks like, it's the same for everybody. I mean, it's personalized, but the process is the same. You go and you would apply. If for some reason that you don't have the 2 years of experience as an LCSW, then you get to have a conversation with me, and I will look to see if there's any like transferable skill sets, and if maybe we can move you along in the process faster. But if you do have that 2 years of experience, then it would be meeting with a clinical talent consultant and then the clinical hiring managers, which is Tracy George and Alexa Parks, and they're just absolutely phenomenal. And so that's how the LCSW journey looks.
I see a question we get all the time, and so I feel like it's an easy one that we can answer, and I understand it. It is one that people always want to understand, and that is, does IRIS have its own EMR or EHR that it works with universally? We do not. We integrate into the site's EMR as to where each provider is placed. Now, we do training, implementation of that EMR, but it is something that is site specific. So know that you're supported within that EMR, but it is dependent upon placement as to what EMR or EHR that our candidates use.
And I saw a question coming in about, it says, what about LPCs? So currently we have openings for LCSWs. However, we have recently, like, we're constantly adding new partnerships, which is, the medical leadership's team is vetting, making sure that this is a good partner for us to take on. And so the roles are constantly changing. So that's a really long answer for saying no, but maybe in the future, and we definitely still want to talk to you. There's, uh, every week we have new opportunities that arise and new partners that need different types of roles and different specialties. So don't hesitate. It might be that we don't have somewhere for you today, but potentially that we could have somewhere for you in the future for sure. And that's my job, is to talk to you and what that looks like.
I saw that we had a question too about, are we currently working within prisons and or nursing homes? And currently we are not. It is really, primarily what Katie had covered as far as the acute care, ambulatory, which really is a lot of community mental health, federally qualified health centers that we are working with. But we are not in prisons and nursing homes as of today. That could change in the future, so stay tuned. Okay, looking over if we have missed any other questions. Well, how do I apply? Katie, I'll let you take that one. How would you apply as a clinician interested in joining IRIS?
Sure. So I would just go to our Iris Telehealth website. So iristelehealth.com. And there's a contact box at the bottom, and our clinical recruiting coordinators will get you in. But we're also going to be following up right after this meeting with links directly to our calendars to get you guys applied if you're interested still, which I'm sure everybody's extra interested now. Do y'all have any other questions that you want to shoot at us? We like to talk.
Yes.
Anybody who's been in a meeting with Dana and I know that we're chit chatters. All right. So,
no, I would just, this is the one more that I had saw that I feel like we didn't address fully, and that is just how long on average does the onboarding process take, such as hiring, licensing, credentialing, and matching? And if you all want to take it, or if you would prefer I go for it, I'm happy to do it.
I think you're well versed in this one.
So as much as I tell providers all the time, I would love to tell you it's going to take this amount of time. It is a moving target, but it's not a moving target without a lot of communication given to each provider as they're going through the process. Also, it is not without us understanding what your personal timeline is. So when you are in the interview process, something that we bring up early and often, because we know it can change as people, understand more about us and think about their preferences, is what type of timeline are they looking to transition work? So that's first and foremost. We need to understand personally what's working best for you, because then that will either really widen our scope as to where we're looking geographically, because as everybody knows, state licenses are not uniform, that there are states that take much longer than other states. Our first and foremost focus is on your placement. So we want to make sure it's the right hours, schedule, setting, patient population. And then we take into consideration the timeline it would take to get licensed and credentialed at that location that would match that. So it's a conversation that if upon introduction of a potential placement that does match your clinical preferences, we have a great team that's already assessed what we believe the credentialing and licensing timeline would be as well. And that way you're given a very transparent view of what we think that start date would look like. And it is dependent upon the state, and credentialing depending upon the organization and how quickly we can work through that. But again, you're very well supported through that entire process as far as communication about what that timeline will look like, consideration, of course, for your preference within that timeline and looking at matches. Is also taken into consideration. And I can't say enough about our team that will work with you throughout that process to do a lot of the heavy lifting for your licensing and credentialing. So hopefully that answers the question. I know it's not an exact date or timeline that I can give you, but it really, your considerations are taken into that, and it's something that we communicate to you upon a placement.
Yeah,
I
we're
would
really upfront. Oh, sorry.
No, I was going to say, having been through the process of applying, I would completely agree with Dana's sentiments about the communication from the team is excellent. The feedback about time frame, because it can be so stressful, right, when you're trying to transition to a new job, and having that support along the way and that communication and feedback about how long it's going to take, as well as I don't know how medical credentialing at Iris does it, but they make it so painless in terms of the credentialing, and they partner with you. So I can't say enough about the support when you're onboarding. Is phenomenal.
And so we had a couple more questions. So here's another one. Do your NPs also work in inpatient settings, or they utilize more outpatient? We have more outpatient opportunities, so that would be more outpatient. However, we do have inpatient opportunities where we utilize nurse practitioners as well. Of course, there's going to be some state dependency. There's certain states that are independent license, and supervision requirements would be in some states different. So to answer the question, yeah, we absolutely do hire PMHMPs to utilize in inpatient roles as well. Another one, and this might be for you, Dr. Muller. What if you run into an emergency situation with a patient, like suicidal ideation thoughts?
Yeah, no, great question. And part of our scoping is understanding crisis management within an organization, understanding those workflows, and then communicating it to the provider, so that, right, there's someone on the ground, you know who's there, you're not siloed. So if you have a concern about a patient, you know what the pathway is, who you're going to reach, et cetera, because we don't want anyone to ever feel they are isolated on their own, and handle crises. And in our positions as well, there's no expectation for after hours or like crisis management outside of your schedule. That's something we really look at. How do these clinical settings handle after hours calls or crises?
Yeah, and just something to remember, that we're not direct to consumer. So you're working within the policies of your location. So there's a brick and mortar location that people are actually on the ground working to help with that collaboration. So just keeping that in mind, it's not like somebody's just randomly, entering your queue on, a tech platform. These are, legitimate brick and mortar locations that are used to these types of situations, and all those things are totally known to you up front, like who to call, what to do. And the really great thing is, because you get your COM, there's always that emergency helpline always. If you can't remember what to do or who to contact, you've always got that stopgap measure. All right, I'm just looking at the questions. So do you provide a collaborating physician for the states that require one?
Yeah, that is another thing when we're scoping out a position. If they're asking for a nurse practitioner, we're understanding what are the needs for collaboration and making a plan for that before even thinking of opening up that opportunity for a nurse practitioner. So that collaborating physician absolutely will be someone that we have planned. It's very often an IRIS provider that may be working at the same clinical site. That's always fabulous. But it will be another IRIS physician that people have an opportunity to meet with and work with.
So this is a follow-up question to the clinical versus admin time. So this one says, hi, can you please clarify how many hours are expected to be clinical versus admin, meeting versus consultation and hours? Example, for 30 hours. And this question's come up a couple times.
I am not sure I'm understanding the question. So for a 30-hour position, how much admin time is allotted, or can you repeat it?
Sure. Hi, can you please clarify how many hours are expected to be clinical versus admin?
I think I can answer this generally, and a lot of it, again, it's very site specific in terms of if someone's doing a full day, how much admin time is allotted versus clinical hours. And Dana, I don't know if you could speak probably better to that than I can.
Yeah, absolutely. So I always tell people I understand. When I think of this question, it's like there's so many moving parts that go into a day. And so I'll kind of back up to the interview process. Is I want to understand, what does your current work environment look like in a day, as far as volume of patients, administrative time that you have, no shows, because then that, obviously impacts, your volume of patients, just any administrative time, if it's scheduled at specific times a day that you're looking at, and then taking what you're doing. And then if you're talking to me, you might want to, replicate that type of a schedule, or make some changes to it. If, no, you know what, I really do need 60 minutes of administrative time. And the reason I'm starting there to clarify is we take that information very seriously, because on the other side of it, it is site specific. So I always want to be transparent in that we have clinics that do have administrative time, 30 minutes or an hour scheduled, paid within the day. I would say it would be pretty rare to see above an hour of administrative time in an 8-hour day, but that is certainly something that we see. And then we do have clinics that partner with IRIS that do not have administrative time in the day. And that might be because they cite a really high no-show rate, which I know, again, is another variable. But long answer to your question is, it is site specific, but it's site specific where we're looking through your eyes as to whether or not that would be a match you would be interested in. So there's not, again, a catch-all that I could answer that. I will tell you again, our 60 minutes for an initial visit, 30 minutes for a follow-up. Administrative time is something that we don't require across the board with the organizations we partner with, but it could certainly be something that they do have included. And if they do, that's fabulous, right? We want that for our providers as well. And so that's something that we take into consideration during the matching process. And I will say on the follow-ups too, I just want to clarify, 30 minutes is really ideal. 30 minutes definitely for any child visits. For follow-ups and ambulatory care for adults, there are times that some of the clinics we partner with do have 20 minutes for a follow-up. So that really may fluctuate from 20 to 30. So I kind of just look at a day as 60-minute initials. If it's generally an adult population, it could be, depending upon the site, 20 to 30 minutes for a follow-up. And then you factor in, does that site have administrative time? If they do, great. If they don't, again, that would be communicated to you. But we're also looking at any potential matches as to what your preference is for each of those things. Hopefully that answers it. If not, definitely communicate it with us by email. We're happy to pick up the phone and have the conversation as well.
And I also just want to call out, like, any LCSWs. Obviously, this is going to be a little bit different for you. You're doing therapy time, so it's very standard. And also, I do want to call out as well that if one of your therapy appointments do cancel for the day, you're still paid. Like, you're we're not doing production-based pay model. That's one of the things, like when I'm talking to the LCSWs, that is a real big driver about why come work for us. It's because, if you do have a no-show that day, your salary is still really stable and you know what you can expect on your paycheck, which I think is really important when you're looking at balance and your life quality. All right. Any other questions? It seems like we did make it through all the questions. And you guys have been a very excellent, good, inquisitive group. So somebody did ask if we should, or how long they just applied, which congratulations. You will be getting reached back out to within the next, I would say, 24 to 48 hours by our IRIS team to get you into the interview process after we review your resume or CV. So that, we're right at time. So I just want to say again, thank you guys all for attending, and gals and everybody that's here. We really, really appreciate your time and getting the chance to talk about IRIS. I always tell people I'm amazed that I get to do this job and just talk about something that I truly love in my heart of hearts, and living my work and loving my work. So thank you guys all so much for attending. We will be following this up with an email as well as calendar links to schedule with us. And if you would like to apply, go ahead onto our IRIS site, and we'll also be including those links as well. All right, and that's all she wrote, guys.
Wonderful. Thank you.
All right, thank you so much, everybody. Have a good day.